Conducting a necropsy. Once you have closely observed the birds and their housing conditions and look at the mortality chart, other performance data, diagnosis given the clinical fact, in order to verify your hypothesis, open carcasses on the farm to verify for the presence of lesions. The necropsy is essential to quickly observe the internal lesions, establish a differential diagnosis, and decide on the course of action. The challenge of a good poultry diagnosis is to identify the most significant flock problems rather than focusing on individual bird pathologies. For large poultry flocks, approximately 5 dead birds as well as 5 individuals showing clinical signs should be selected for necropsy. Euthanasia of the sick birds should be performed rapidly and humanely in accordance to ethical standards. For further analysis and confirmation of your tentative preliminary diagnosis, birds or samples should be sent to an animal diagnostic laboratory. Taking samples. Some samples can be taken when birds are alive. Blood samples, tracheal swabs at postmortem. Blood samples are usually collected for serology. Bird sera taken 2 weeks apart will be desired if seroconversion to some disease is expected. In adult birds, collecting eggs will also serve this purpose since antibody titer can be measured from the yolk. Blood can easily be sampled from the brachial vein in most birds, such as young and mature chicken, while the tibutarsal vein is a good option for turkey and ducks. Dampening the skin with 70% alcohol will help to better define the vein. In most birds, half to 1 inch 21 to 22 gauge needle, depending on the size of the bird, with a 5 ml searing will sufficient. Don't use a vacutainer for a vein blood collection, as the vein will simply collapse, but apply a gentle steady negative pressure on the searing plunger to withdraw blood. Avian blood will easily coagulate during sampling. For most serological analysis, a 2 ml blood sample will be adequate. Blood should be collected aseptically in a vial and laid horizontally until it clots, placing a vial in warm water right after. Collection will hasten the clotting, while refrigeration will hinder the coagulation process. Collection will hasten the clotting, while the refrigerator will hinder the coagulation process. Sera can then be transferred in vial, put in ice, and shipped to the lab. Never freeze sera if agglutination tests are planned, since this might cause false positive reaction. Upon performance the necropsy, numerous tissues and organs can be sampled depending on the observed lesion. If bacterial culture or viral sample are needed, they should be collected as aseptically as possible using sterile scalpel blade. Collect joint sinus exudate. Shipping whole or part of the organs to a laboratory is also an option. Tissue for histopathological examination can be immersed into 10% formalin or other fixative immediately after death. Specimens should be small for quick fixative penetration and preserved in 10 times their own volume. Ensure the container is tight and leak-free for shipping. Purpose alternative shipping. Remove specimen for the jar and ship in the poly bag with paper towel dampened in formalin to keep the tissue moist, but that will not crack or leak or spill in transit due to the sensitivity of the shipper. Label the bag of course. Feed sample should be collected from the feeder if a problem with an ingredient drug level is suspected, when there is feed refusal, or whenever mortality, drop in egg production, or poor growth performance are unexplained. Water from the wells and from the end of the water line should be analyzed at least once a year to determine microbiological and biochemical characteristics, and water pH and chlorine level can be estimated with specific color strips. If ventilation is suboptimal during the visit, ammonia, CO2, relative humidity can easily be measured with the appropriate instrument. Barn temperature can be measured and comfort zone can be established with an infrared thermometer. Many barns are also equipped with computer-controlled ventilation system monitoring and logging minimal, maximal, and mean barn temperature as well as relative humidity. The visit report should include farm barn identification, description of the problem, who and what and when and where and how, clinical observation, necropsy, finding, conclusions, and recommendation based on the available fact. A tentative diagnosis can be offered pending further laboratory test results. Confirmation should be given as soon as possible via the phone call to the flock owner or manager or technician. Thank you.